G'day and welcome back to the channel. So in today's video, I've turned to Reddit and more specifically the back pain subreddit to hopefully answer some questions and to draw some inspiration to talk about some of the common misconceptions about back pain, some of the things that a lot of people could be doing in regards to their back pain that they might be missing, and give my take and my perspective on a lot of these things that you may be going through if you have back pain yourself. Now, it obviously goes without saying that as a physio, I can't offer specific advice over the internet without assessing you first. So please take the information given in this video as a general guide or a general perspective or my general perspective on how I see back pain and what I find is important with back pain. And I hope that you can draw some inspiration from these sort of conversations and this information and give yourself the best chance of conquering your back pain and potentially stopping it from coming back in the future. So the first question that I wanted to highlight is based off someone by the name of Busy Distribution 470. And it's a really common question, one that I get a lot clinically, and it's basically what's causing my sciatica? Now, this is obviously a very broad question, and it's important to understand that most people's sciatica is going to be different. Everyone is unique in their symptoms, how their pain came on, what's needed to do to fix their symptoms, but it does raise a really important question. The idea that I think is important to take from this is that we need to think of sciatica as a consequence of something. So you didn't wake up one day and you didn't just go from perfect to having sciatica. It's very likely in a lot of cases that you've been heading towards this period of time for a long time, and it's only once you breach your tissue's threshold of coping that you then develop the symptoms of sciatica. So we need to get people into the headspace that even if you bent the wrong way, if you moved a certain direction, you lifted something or you did something and instantly got pain down the back of your leg, it's still really important to understand that that didn't just happen in an instant. It's likely the final straw or the last moment that tipped you over that threshold to give you those symptoms. And the reason why this is really important to understand, if we're just looking at your sciatic symptoms, then we're missing the bigger picture of why that happened in the first place. And I'm talking beyond maybe a disc bulge or some stenosis or something like that where the nerve root's getting irritated. These things don't just happen overnight. Even if it feels that way, it's generally that last straw like I mentioned. So we need to look at the boring things. We need to look at how you load your back day to day. Are your hip joints stiff? So when you're bending over or sitting and leaning forward day to day, you're no longer just doing it through your hips, you're bending through your lower back and overloading that section of your spine that's now causing your sciatica. How is your core strength? Are you someone that slouches and sits poorly day to day and is consistently overloading that tissue to the point where it's now become sore? And these questions are really important to ask yourself because the answer to those questions will be subtly different for each person. Yes, we need to respect that sciatica. We need to understand that your sciatica is a very debilitating problem, or it can be a debilitating issue in the short term. But long term, in order to fix this and to solve this for you, we need to make sure that you understand the broader context of how that sciatica fits into all the tissue around that and how you load that tissue up day to day. So our next question comes from somebody by the name of Azal147 or Ashal147. Can lumbar pain cause foot neuropathy? Now this is a really important question because it's something that we see a lot clinically. If you do have low back pain, depending on the type of issue that you have and what structures are involved and to what degree those structures are involved in your low back pain, it is possible to have some foot-related nerve issues going on there, whether that be pins and needles, numbness, burning, tingling, weakness potentially, depending on what sort of degree that nerve's involved from your lower back. It's an interesting concept because what we tend to see clinically is it's very difficult for your body to develop one issue, let alone two completely separate issues that aren't actually related. And what I find clinically is there aren't generally too many coincidences in the body. So even if you have some foot-related issues, maybe an ache or some pins and needles, some numbness or something like that, and you don't have overt low back pain, that may still be coming from your lower back. And what's really important with any thorough assessment is we want to connect these dots where we improve the low back function and hopefully see a resolution or at the very least a positive improvement in your foot symptoms. And if we see that enough, then we can genuinely start to make those connections between those foot symptoms being connected to your lower back. Now, it's also really important to piggyback off what we talked about a second ago with sciatica, is that we don't want to just get you stuck treating your specific symptoms. So if you have some foot-specific symptoms and you're just treating your foot and you're not looking at maybe the role that your lower back might be having on those symptoms, then the chances of you completely curing or at the very least optimizing that area to the best of your ability become lower because we're not necessarily treating the underlying cause or the context that's created that symptom in the first place. So our next question revolves around lower back pain with bodyweight movements, in particularly bodyweight squats or deadlifts in particular. Now, this is a great topic of conversation because, again, we don't want to blame the activity that seemingly causes your pain. We want to take a step back and try and understand the context surrounding that. So when looking at something as simple as bodyweight squats, a bodyweight squat, by definition, is a normal movement. We are designed to squat, we are designed to move in that way, particularly because there's no excess load going through the spine when we do those squats. And this is really important because it speaks to bodyweight squats and the repetitious nature of those bodyweight squats, exposing something that you took into the bodyweight squats, not necessarily causing something. The number one issue that a lot of people take into bodyweight squats and something like deadlifts is that their hips are stiff. And what this excessive sort of decrease in hip range of motion tends to cause is that when you get down to a certain depth and you explore the depth of that hip range of motion, then all of a sudden your body has to compensate around that. In terms of a deadlift, what that obviously means is instead of hinging through your hips and knees to complete the deadlift, it's much more likely that there's load going through your lower back in ways that it's not designed for. So when doing a bodyweight squat or a deadlift, your spine should maintain a relatively neutral position all the way up and all the way down. At no point should that low back round at all. And if you have some hip stiffness and potentially some underlying or overlying low back dysfunction, even if that's not painful before doing the squats, repetitious movements can bring that out of you or expose that a little bit more than when you didn't do that. So our next topic comes from 0TXH, who comments about sacroiliac joint pain. They've had sacroiliac joint pain for a while now, and some of the SIJ exercises tend to make it a little bit worse, a little bit more painful. And unfortunately, this is really common, and I think one of the reasons why SI joint pain tends to be a little bit misunderstood is that I think we're missing some of the important context to frame what it actually tends to be. Now, we tend to look at a lot of SIJ pain as maybe a malalignment of that sacroiliac joint in regards to the pelvis around that, but we don't often talk about why that tends to happen. There's two things that I find really interesting about SIJ pain, and the first one is that it can be heavily dependent on how stiff your hips are. So again, similar to what we talked about a second ago, if you're missing some hip range of motion, your SIJ is the next mobile joint above your hip joint. It is very much a harmonized system where if you're lacking range of motion somewhere, it has to try and find that range of motion somewhere else to complete the same tasks. If you've got an instability through your SIJ or just general SIJ pain, we need to make sure that you're looking at the hip joints themselves and how mobile they might be in case they're shunting a lot of unnecessary force through that area. And as a long-term strategy, I would highly recommend everyone talk to their physios and physical therapists about that to make sure that you're not missing something crucial. And the second point about SIJ pain that I see a lot is it can be misdiagnosed quite a bit. And what I'm finding clinically is that there's a section of your lower back at the base of the rib cage, at the top of that lower back, and that section of your lower back can refer pain down to your SIJ. So not only is it really important to make sure that the pelvis itself is functioning well with all the SIJ tests and SIJ exercises, but it's also really important to explore this hidden section of your lower back just to make sure it's not referring pain down to that SIJ and giving you that unnecessary label of SIJ dysfunction. So it's really important to make sure that if you're trying to figure out which one of these three areas, is it your back, your SIJ, or your hips, which is the fundamental cause of this SIJ pain, so that you can make changes to that going forward so that it doesn't come back again in the future. So the next topic that we're going to talk about is a really, really important one. And it's posted by someone called Psychopathic Veggie, and it's in regards to chronic back pain. And they've just posted it and they've self-proclaimed this as a rant, but I completely understand because chronic back pain is a challenge. It's a real challenge for a lot of people. And I think the first thing that's always really important to mention for anyone out there struggling with chronic back pain is that what you're going through is 100% valid. You are not crazy. What you're going through is real. It's just that the industry at the moment isn't at a point where we don't have the answers as much as we think we do. Now, this is a really important topic because we need to frame exactly what it is that you're going through. And I think the important thing about chronic back pain that we need to touch on first and foremost before we get into this is that chronic back pain isn't just a physical problem. Yes, there are going to be some physical issues going on there, but we need to think of chronic back pain as a holistic issue not just an issue with a disc or with a muscle or a joint or a nerve or something like that. The tissue damage in your back often doesn't equate to the amount of pain that you're going through, which is why this is such a frustrating condition for people to experience, and why people in my industry can make you feel really frustrated because they don't have the answers to your dysfunction. Because you may get an X-ray or an MRI, and ultimately they don't find this issue that makes you feel like that's the cause of your pain. They might find mild symptoms or mild dysfunction, and it doesn't validate how you feel because you feel like you've got a lot of bad pain and it's really debilitating for you day to day. And that's what we need to talk about, the other aspect of chronic back pain. We're talking about your nervous system. And what I mean by this is your body is inherently designed to go through a fight or flight response in moments of stress. You have a parasympathetic nervous system and a sympathetic nervous system who have opposing roles. The sympathetic nervous system shunts you into that fight or flight response. You get that sudden rush of adrenaline to help you combat moments of high stress, whether you need to fight your way out of it or run away. That sympathetic nervous system kicks in to heighten your nervous system's capacity to help you in that moment. And the way the body's wired is that at some point very soon after that, your body is then designed to drop back down again to a more natural baseline via your parasympathetic nervous system. And one of the things that I find clinically with a lot of people who experience chronic back pain is that they tend to be sort of trapped in this heightened nervous system response. Their baseline tends to be a little bit more geared towards a sympathetic heightened nervous system response, as opposed to that sleeping dog baseline response that we all deserve to be in day to day. And the trouble with this is that when you're in that heightened response, your pain sensitivity tends to be worse, your threshold for pain tends to be lower, and the persistence of your pain tends to increase as well because you're in that more heightened response. The other thing associated with chronic back pain I think gets overlooked a lot is that a lot of people who are in this heightened response have been through some version of trauma or going through some traumatic experience in their lives, whether that be the nasty things like sexual abuse, physical abuse, even things like high financial stress, work stress, religious stress, financial stress. There tends to be this baseline of something that you may be dealing with that's important to understand, that you also need to respect and hopefully start to take steps to either change or to deal with a lot more and try and find ways to drop that nervous system down, whether it be through deep breathing or massage or talking to someone, counseling, all those sorts of things. And once we can get you to a physical and a mental point where things are more positive, then we can start to see that the issues associated with chronic pain can start to resolve themselves and start to decrease long term. So our next question is a little bit different. The person I'm quoting here is talking about having pain between their vertebra and their scapula. So essentially in the upper back, in between the shoulder blades, or sometimes underneath the shoulder blade. And what's really important about this is that we need to make sure we're treating the right thing. And what I find clinically is a lot of the treatments that we tend to give people, whether it be massage, acupuncture, heat therapy, creams, a lot of these sorts of things that we tend to gravitate towards tend to be superficial treatments. And ultimately, a lot of the issues, particularly around the shoulder blade and that upper back, actually tend to be deeper issues that we need specific treatments to get to in order to make the superficial things be more effective. So if you're having some pain around that shoulder blade, maybe it feels deep to your shoulder blade or between the shoulder blades, there's three things that you need to really focus heavily on based on what I'm finding clinically and based on hopefully what you find when you see someone clinically. The first one's obviously strength. There's a lot of people that tend to get a little bit weaker through their scapular muscles. So, seated rows and scapular exercises to improve your scapular stability and your scapular function. But again, if you're a follower of the channel, you know that I don't believe that strength can fix a lot of the deeper joint stiffnesses that we tend to have. So if you have some deep stiffness in your thoracic joints and some stiffness in your rib joints up in that area, then that is going to stay there potentially unless you specifically go after them. And I find that using a tennis ball or a lacrosse ball, looking for where the stiffest versions of those joints are, lying down, leaning up against a wall, whatever you feel you need to do, getting in there and trying to decrease some of that stiffness through that upper back. I find that's potentially the missing piece to a lot of the scapulothoracic upper back dysfunctions that people tend to have. But then ultimately, we always need to have a conversation surrounding why you have this issue in the first place. I tend to find your upper back and shoulder postures tend to have the biggest say in the accumulation of that dysfunction. It's very likely that where you find the most stiffness and tightness tends to be is probably going to relate to where you find you lose that shoulder posture the most. So if you're strengthening up those the muscles in the area, freeing up your upper back and the joints underneath that are potentially the cause of that dysfunction, if you're not then putting things in a better posture by taking your shoulders back, then ultimately you may not see this resolve long term because you're basically undoing all the hard work that you put in. But again, make sure that fits the bill based on what someone's told you from an assessment. So the next post that I wanted to cover is by someone called monkeyman9812, and they basically just said, just got these x-rays today, haven't been faxed to the doctor, can anyone help? And this is a really important discussion point for a lot of people with back pain, because if you've had any scans at all, and we'll lump MRIs into this conversation as well, is that they need context. Just looking at your MRI, just looking at your x-ray, or reading the results from those scans isn't enough to give a diagnosis. Yes, we tend to look at what's going on there and pair it up with an assessment to see what fits. But ultimately, the danger of getting an MRI and an x-ray for a lot of people is that it gives you the wrong impression of what's going on. Because most people who will get an x-ray will have some form of wear and tear or degeneration at the base of their spine, whether that be through disc, the joints, whatever it might be. So if you have pain in that area, it can be very easy to attribute that wear and tear to your pain, even if that wear and tear was there beforehand. And the problem with this thinking is that if your back pain came on 2 days ago and you got your x-ray today, that wear and tear doesn't come on overnight. It takes a long time for that tissue to degrade, to get to the point that you'll see. But the trick is that you just didn't get an x-ray 6 months ago, 12 months ago, a year ago, 2 years ago to compare. So you're only really going off one piece of information that can be really easily misread and misinterpreted based on your aches and pains. So what's really important to understand is that you need a thorough objective and physical assessment and subjective assessment to figure out where your pain is coming from, what your pain is relating to, and then the x-ray MRI is best used if you don't necessarily have all the information that you think you need. Because again, it can lead to you thinking about things the wrong way, going down the path of missing some obvious things, particularly things that don't show up on a scan. In my experience, joint stiffness, muscle weakness, postural habits, the positions that you put your body into don't show up on an x-ray. And that context is really important to understand the bigger picture of why you have your pain, irrespective of what it is and how long you've had it for. We can give you all of these thoughts and fears that you don't deserve to have, maybe in terms of arthritis, being labelled with a disc bulge can be a life-altering experience. It can really change your perception of your body physically and your physical health completely unnecessarily, because you can have a disc bulge that doesn't have to give you pain going forward.